So we're on to the next skill demonstration. And there are two big things in this skill set to notice. One is reviewing the chart and letting patients know that we actually did a review with specific things that we found in their history that are important, especially for this visit. And it can be things like a recent urgent care visit, a recent ED visit, or a recent discharge from the hospital that are pertinent to why they're with you in the clinic today. By getting really specific about what we know from the history, patients have an increased sense of trust that we have the whole picture in mind. Other tools that can be helpful with this are things like using the exam room computer for this chart review, because all of that information is so readily available right there in the conversation with patients and their families. The second big thing is the something else question to draw out what patients are really concerned about. And the reason this one is important is because it comes from a study out of UCLA about 3 years ago, where the researchers tested this question, something else that we should focus on today. Is there something else we should take a look at today versus is there anything else? The study showed that the something else question was 80% effective at drawing out unmet concerns, and the anything else question was almost like not even asking. So try to focus on one or both of those things this week, but the particular one that you may not be used to is the something else question. We found when we've worked with your colleagues on this one, that's the one that was most effective for putting together an agenda and drawing out those concerns, but also sometimes a little bit difficult to get into their repertoire. So this week, think about what skills you want to practice, one or two of these, or maybe both, and also think about this question: what will remind you to use the skills during your clinical interactions this week?
The skills that you will be working on these next few weeks are: demonstrate knowledge of patient history and verify reason for a visit, listen without interrupting during the first minute to get patient perspective, listen and look like you are listening, ask, is there something else we need to cover today, which draws out unstated patient concerns. Now let's watch our experts in action.
So I was looking through your chart, and it looks like Dr. Bachman sent you over to look at a pilonidal cyst.
Yes, that's
correct. Tell me about that.
Well, you know, about probably a month ago I noticed it, and I was just out going for a walk, and I noticed this horrible...
Is there something else about this problem that I need to know?
I don't think so, but I was on antibiotics for 2 weeks or so, and I
So Sadia told me that you were here because you were having a lot of trouble with your asthma.
Yes.
And I saw in your chart that you were in urgent care just a couple days ago too.
Right, that's right.
How are you doing now?
You know, it's just been really frustrating because it's not just the asthma.
Mm-hmm. It has been a tough time. Is there something else besides those symptoms that we should talk about today?
Yeah, I'm kind of embarrassed to bring it up, but I know that I have to. I started smoking again after not smoking for 8 months, and my husband doesn't know this right now, so.
Wow.
Mm-hmm. Mm-hmm.
Yeah.
Well, that's very brave of you to bring it up here. What's been on your mind about that?
This is the end of the video. Some people have used yellow sticky notes taped to their monitor or office door frame for an extra reminder of what to focus on for the next encounter. See you next week.